All right. Oh, welcome to the chat. Remember to go ahead and yes, I will try. All right. This Toki from MM Medical. Just well, the YouTube channel name is the Joint Reduction Simulation Lab. So basically, this channel is to show how to reduce dislocated joint by using the simulator. So this one is the finger dislocation simulator. So this model, you can recreate the finger dislocation like you see basketball game. The famous one is the Kobe Bryant. He got finger dislocated and he came off the to court talking to the trainer, and then the trainer just fixed it and tapped his head, and then Kobe Bryant, he went back to play. So just the finger model, so you can dislocate like this. So the middle finger is the most common finger to dislocate, and this is the most common PIP joint. This is the most common joint to dislocate. So this one can do that, okay? How to put it back? Push with this, and then pull with this hand. If you do that, snaps, okay? You have to use actual traction. You're not gonna pretend, okay? So this model got a system inside, so it can make it easier, harder to, test your skill, okay? And if you're a clinical professor, you can use this model to, train the student. Also, you can test the student, okay? So this is the elbow dislocation simulator, okay? Pound Kumar, how are you doing? Hello. So this, you can dislocate the elbow, okay? And there's a couple different techniques. So one technique could be, let me change the camera angle. Okay, so patients on the exam table facing down, okay? And then pull little extension and then pull down. If you do that, it can go back in. Tension is adjustable. People ask all the time, it's not that easy. Well, if you can reduce on site right away, it's easier. I'm not saying it's easy because it depends on the situation. Okay, this person could be 300 pounds, you're 100 pounds. It's gonna be hard either way. Okay, so this is the elbow model. Another technique would be patients on the exam table, and then you're gonna use that arm to straight and push, and then pull. It can go back in too. Okay, another one will be patient already sitting down on the chair, okay, and they use the back side of it, okay. Just think this is the back side of the chair, and push against to it, and then pull. Okay, again. Okay, so you really have to use actual force to do that. Okay, so so far the finger and the elbow. Okay, this is the shoulder model. Okay. Okay, it's already dislocated anterior to the front, okay? And there are a couple of different techniques to do. Actually, officially it's the 21 techniques. So this is one of the techniques I use, okay? Use your hip, use your elbow, squeeze patient's forearm, okay? And then your body and the patient's arm is gonna be one piece, okay? So what you want to do is just from here, you want to come to here. How you going to do that? Shift your weight, okay? And so once you get to here, push and then lean back, okay? If you do that, clunk, Went back in. Okay. Okay, thank you for the comment. Hello, hello. Handy. Well, so this is the thing. People, let's say you're playing basketball and you got a dislocated finger, right? This is a finger, or dislocated elbow, and then you go to the emergency room. You assume the ER doctor, they practice, they know what to do. The fact is, no, okay? They're waiting for you to come to the emergency room so they can practice reduction technique, because there's no way to practice. Every actual reduction is a practice. So they're waiting for you to come so they can practice on you. And then you have to pay for it. Well, in the US, I get some comment from overseas, and no, in my country, you don't need to pay anything. Well, actually, you somewhat in a different form you're paying, tax. Anyway, so my product is just teaching, learning, hands-on product. So, healthcare providers, they don't need to wait for somebody to teach them how to do. They can learn this in the classroom as many as they want. Okay. Again, the tension is adjustable. People, always make a comment, well, it's not that easy. Well, it's easy, if you can reduce on site, if you know how to do it, if you're trained to do. Okay. Well, where are you from? I'm Japanese, but I live in Texas for 33 years. So, yeah. All right. So far, finger, okay, push and pull, snaps, elbow dislocation, okay, push and pull. You see that snap go back into the joint? Again, go back in, okay? What are you making? Well, I'm not making, this is the actual product. It's a hands-on task trainer to practice how to relocate dislocated joint. This is a dislocated finger. You have to push and pull. You go back in. Okay? This is the elbow. So the Japanese, yes, I am Japanese. Japanese, that thing, what do you mean? Japanese? Yeah, I'm Japanese. Okay, so this is the elbow dislocation later. Okay, it's dislocated. This could be, let's say, patient's on the stretcher already and somebody's holding his arm, and then you pull, little extension with pull. If you do that, snap back in. Okay. It's Japanese, that thing. What is that? Education committee doctor. I'm not a doctor. I'm an athletic trainer in Texas, state of Texas. Manual fencing, Spain. Hello, how are you? That's awesome training device. Train terror. Thank you. That means a lot. I worked so hard to get here, so those comments, that means a lot. Thank you. You look like Jackie Chan. No, he's Chinese, I'm Japanese, blah, blah. All right. Wait, if legs stop moving. What if your legs stop moving? What do you mean? What do you mean? All right, so elbow. You have to really push and pull, okay, to achieve that clunk. Shoulder. Dislocate it, okay? And push, and then counter traction. If you do that, let me start. angle. All right, if you push and pull, you achieve that. Clunk, go back in. All right. This is the, shoot. You all look the same. What's the difference? You look all the same. What's the difference? I don't know. Are you a doctor? What you actually smart? I'm an athletic trainer, sports medicine. I worked for high school setting for 20 years. So, all right. This is the latest model I created. This is the hip dislocation simulator. So, hold up, let me set it up. Okay. So, it's dislocated posterior. I don't know if you can see it. Okay. Usually this is supposed to be in here. Okay. So, there's an ER drama called Pit. One of the story was there's a hip dislocation patient comes in, and then they pick one resident, and then teach how to do it. But only one resident get to practice. Okay. I don't need to see it in action, please. Then don't just turn it. Just get out. I don't. Okay. So this technique called Captain Morgan technique. I think it's smart technique. Okay. It uses basically physics. Okay. The lever technique. Okay. You put your knee under the patient's knee. Okay. And then push the toes down. If you do that, it goes back in. Okay, and there are the techniques, but cool. Body parts, are they used for CPR training? No, this is not a CPR training. I got the idea from CPR though. Okay, you think about that. If you're a healthcare provider, every single one of them, they have to have a CPR. How you do that? There's a device to practice so that you can get better, and then they will test you and then get the certification. Okay. Reduction technique, there is no way to practice. I came up with a device, so now you can practice, but there is no way to practice. Well, now you can practice, you can get better, you can test. So it's a task trainer to improve your clinical skill. Okay. Same thing as, if you go to the emergency room, you assume those doctors, they know how to relocate dislocated elbow. They practice, they practice so many times, like CPR. No, they're waiting for you to come so they can practice on you, and you have to pay for it. Should be the other way around, because you let them practice, right? But you don't know that. You assume they practice. No, the fact is not. They practice on you. So, Acorizal City, Brazilian. Yes. Put it back in, pop it back in. Okay, so dislocate it, pop it back. So yes, to practice that skill. Help me fix my shoulder. Teach me. You got shoulder. This is the technique to reduce dislocated joint. You got some the frozen shoulders. I can help you. Okay. Christian Bridges. I don't know what is funny, but anyway. So let's go back one more time. So it would be awesome to get these in all the older folks home. Well, yeah, especially on the hip one. Yeah, yeah. Some people, you know, if you get too old, you got a total hip. Okay, all right. Finger, okay, dislocated finger, okay. I do sometimes do this way, okay, all right. You put your index finger underneath and then wrap around and then put your thumb on top, okay. I don't know if you see it, and then pull this way. It's in. Again, put your index underneath and then wrap around it and put your thumb on top and then pull. Snap. Okay. Elbow. Dislocated. So elbow dislocation, you know, you see a lot from falling. You know, you lose control, you losing balance, you're trying to catch yourself, or jiu-jitsu or wrestling. Okay. All right. So this is a face-up technique. Okay. Think about it. This is patients on the ground. This is this table. Okay. Patients facing up. Hold it and then pull up. Little open it up. Now it's in. Okay. Shoulder model. Okay. Dislocate it. Okay. Shift your weight and then counter traction and traction. If you do that, watch here, go back in. Okay. Okay, and this is the hip model. Okay. Now it's dislocated posterior, if you see it. Okay. So this technique called Captain Morgan technique. If you drink, you know, rum, you know, the Captain Morgan, he put his legs up at 90 degrees. So if you think about it, if you lift this one up, looks like Captain Morgan. So somebody named it, okay? So the technique wise, you put your knee under the patient's knee. Instruction unclear. I dislocated my own arm. You dislocate your arm, your elbow or shoulder, I don't know. Okay, so put your knee on the patient's knee, and then the physics, okay? If you push your toes down, what's gonna happen? It's gonna go back up. So that's the Captain Morgan technique. So any requests, question? Where you all from? I mean, state of Texas. Even though I'm Japanese, I've been living in Texas for 33 years so far. So anybody? Anybody from Texas? Nobody from Texas? Okay, well, I guess no much interaction. Okay, I guess I'm done. Thank you. Oh, Houston, cool. Shoulder down, what does that mean? Sir, I had an ankle surgery a year ago. The implant got removed since July, but my ankle seemed to be swollen a bit. Yeah, I bet your body is trying to adjust the difference. It takes time. Okay. Sir, can you show in exercise? What does that mean? I don't I don't understand what's being. Save me. I'm in Houston. What do you do? No. Okay. Any questions? Can you show an exercise and even the full movement? This is a reduction skill training workshop. So sciatic pain, get a golf ball and get on the back and then roll it. Isn't return the full movement of my ankle. It's not as earlier. Well, you need to work on your range of motion. You need to go to PT. What do you recommend for sciatic pain? I'm not specialized into that. I mean, stretch, massage. So, I guess one more time I go through and then they'll be done. Okay, finger dislocated. Okay, middle finger. Okay, so your finger, the middle finger, this part come on top like that. That's how it look like inside of it. Okay, push and then use this one to pull, push and pull. Little extension, snaps. Go back in. Okay, elbow dislocated. I told you you need to, I don't understand why you don't. All right, so this is the elbow one. What do you do for a sprained ankle? Suck it up and keep playing. Sounds mean, but that's what it is. I mean, if you're gonna take a time off, get better, how long? You need to just take the pain and play. All right. So elbow dislocated, push and pull. Okay. Again, push and pull. There you go. So, any questions? I guess not. People ask me about the ankle sprain. I don't know what to tell you. Okay, this is the reduction technique workshop demo. So, all right.